Thank you, Dr. Simmons. The microphone that I have on is for the camera, and I hope that you can hear me all right. Is this voice level going to work? For the people in the back, are you all right? Can you hear me? A little more? So I may have to be reminded from time to time. Cultivating compassion is the topic that I offered, and it was accepted as a proper topic for this venue. Cultivating compassion for the well-being of physicians and their patients. Now, it could be cultivating compassion for the well-being of researchers, for the well-being of staff. It just happens to be I was invited by the Department of Family Practice at a medical school, so I titled it for physicians and their patients. But it could be physicians, medical students, their patients, their families. I don't think there's any boundary around the need for cultivating compassion or the appropriate audience for cultivating compassion. So as I've thought a little bit about presenting this, I've thought a lot about where do I think my own roots in an interest in compassion may come from. And I have to start by saying that I really don't think I know enough about it. I think that there's probably plenty of people in this room who know a lot more about compassion than I do, and I want to begin with that disclaimer. I'm here as a serious student of compassion, not as an expert in it. Thank goodness for lifelong learning, which is a value that we honor in medical education, whether it's biomedical or holistic or integrative. And I've got the rest of my life to learn a lot more, I hope, about compassion. At least that is my intention. You know, I think that I've taken for granted during the early part of my life having unconditional love from my parents, my grandparents, my siblings, and being looked up to. I wasn't a bad boy. I was a good student, a good athlete, these sorts of things, a good citizen. So I made it kind of easy on them. But even when I was not perfect, and there was plenty of that, there was a bit of a rebellious youth in me up until the age of about 25 or so. Even at those times, I felt no judgment from my family. So I think that people who labor under a history of neglect and even abuse may have a more difficult time with their own choice to learn about compassion, be intent on it. But I think even they probably, I hope, know it when they see it, know it when they feel it, and know it when it's directed toward them. One of my early influences, as I've thought about talking here today, is a family physician, general practitioner, Dr. Phelps, that came to my home many times as a youth. Unfortunately, it was in the 50s. Penicillin has been the savior against certain bacterial diseases for the last 15 years or so, and so he often gave a shot when he came to see me, but he gave it from a compassionate place. And he remained the family doctor for a long time. When I chose to go to a rural community and practice much like that, I thought of him a lot. The golden rule is something I'll be talking a little bit about, and it kind of is a common denominator across religions and is an invitation, even a mandate toward compassion. If you're an advocate of a certain religious community, we'll see some of that in a moment. I think probably growing up, if I'd been asked where the golden rule came from, I would have probably said the Bible. And I would have thought it probably was only from the Bible because I didn't know about other places. But it certainly isn't restricted to Christianity. It didn't begin with Christianity. And we'll see a bit about that in a moment. My father told me once, a few weeks before he died, that he always considered himself a religious person. Now, this was someone that, from my point of view, was not a religious person. Although he took us to Sunday school, I didn't consider his behaviors to be one that I would have thought a religious person would have. But I think I inherited something from him that's kind of an unstated ethical principle, and the Golden Rule may speak to it as much as anything. Because when I asked my mother many, many, many years after he died what he might have meant by that, she said, after thinking about it for a while, well, he had a code that he lived by. And as I thought about myself for many years, whether I've got an associate who's leaving the practice or an employee who's leaving the practice or some issue come up with a landlord that I'm renting for and I have a negotiation kind of a thing to talk about, the word that's always come to me is fairness. Whether it's this raise you're wanting or whether it's this separation that we're about to undergo or whether it's negotiation about this building I want to rent from you, fairness has been kind of a guiding principle for me. And I think the Golden Rule kind of underlies that, though I haven't always thought of it necessarily in those terms. If I can do this, I want to show you something that some of you will remember from having been there in the 50s. There was a show called Ben Casey. I wonder if we're going to have audio. Well, we'll find out. This is only 18 seconds.
Man, woman, earth, death, infinity.
Now that was on TV, early TV in the 50s, once a week with Ben Casey. And I don't know how many times I've tried to find that, but now with YouTube, of course, we can find anything we need. And although it wasn't intended as a hypnotic suggestion, I think that man, woman, birth, death, infinity had this kind of little hypnotic suggestion for me, and I suspect for a lot of people also at that time. I think it kind of infused me with a broader appreciation for what medicine is all about from an age much earlier than I really would have thought in terms of specific training events. Albert Schweitzer died when I was a freshman in college. And I remember very clearly when I was choosing to make medicine a career choice 2 or 3 years later that his inspiration was one that I drew on in making that career choice. You may know he had a doctorate in music, was an acclaimed organist, concert organist. He had a doctorate in theology, and it was after both of those doctorates he decided to go to medical school to get an MD degree, specifically to go to Africa for the rest of his life and serve very, very impoverished, marginalized community. Something else that I think is maybe an origin of my adult experience of compassion was reading a book called I'm Okay, You're Okay, a transactional analysis book. I read that book and at some point I remember studying the book down and thinking, oh my God, it wasn't his fault. Thinking about my father. And I remember that as being a pivotal moment in my acceptance of this difficult relationship. And it made the next few months prior to his death a very rich experience that I'm very grateful for. I also, by the age of 27, had 9 family deaths. 3 grandparents, 4 aunts and uncles, a brother, and a father. And then a suicide of a medical classmate and a lab partner, all by age 27. I don't know to what extent that impacts my interest in compassion these days, but I think those may be contributing factors. So growing up Methodist, do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, as long as ever you can. John Wesley, the founder of Methodism. So compassion has guided a lot of my choices, I think, for a long time. I've been an idealist for a long time. My mother accused me of being an idealist. She was half cynical about it and half flattering about it when I was making choices that didn't make financial sense, you know, buying a piece of wooded property that didn't have any income potential just to preserve it. Medicine as a career, I think, was a statement, a compassionate statement, a choice in compassion. Learning to meditate in 1972, 1973, you got the first two articles by Keith Wallace and Herb Benson, the second of which was published in Scientific American, called The Physiology of Meditation. I just had an undergraduate degree in psychology, so I think I was primed for the mind-body connection. I read the article and I said, this is for me. I learned TM within about a year or so, and it helped me through a very, very rigorous kind of boot camp internship in Memphis. Choosing family medicine as a career choice a couple of years later definitely was motivated by an interest in a compassionate practice of medicine. Schweitzer being that example. Being a founding member of the American Holistic Medical Association during my residency was a statement not of an interest in holistic medicine as a bunch of techniques that are outside biomedicine. No way. I don't even describe myself as a holistic physician. Other people may do that, but I actually kind of stay away from the term. I use the word integrative. You may know the term integrative medicine, which basically means taking biomedicine, which we're all steeped in respect and need, and putting with biomedicine safe, effective, evidence-based, and hopefully affordable complementary and alternative approaches that make an integrated medicine that I like to call real medicine, or medicine of the 21st century, or future medicine. But future medicine in that type is actually a combination of very ancient medicine with modern technology. Cliff Kuhn, is he former faculty or is he still current faculty? Cliff Kuhn in the Department of Psychiatry, former, had an article 25 years ago called The Spiritual Inventory of the Medically Ill Patient, and there's a great chronology of the history of healing, actually the trajectory into the physician of today, which begins in shamanism, physician priesthood, witch doctors, tribal medicine man. Choosing to go to Estill County for 30 years and practice in a rural community, a healthcare underserved area, I think was a statement of a compassionate streak. And preserving property, I've already mentioned my mother's disdain for this poor investment. Buying wooded property in the Red River Gorge area, and then adding more to it and adding more to it. Buying an old hotel in downtown Irvine, my practice on the first floor, putting more money into it than I had in my 401k. These sorts of things, luckily I didn't have a wife or children, so I'm not suggesting that for everybody. But these were choices I made that I think were a statement of my interest in giving at the same time I was practicing medicine, giving something to the community and giving something to the patient population that would come into this beautiful building, remodeled. And then going back to graduate school, halfway through that 30 years, getting a master's in public health, specifically so I could develop as a special project, instead of a master's thesis, develop a pilot project, a wellness project for medical students. So for 15 years I've taught various iterations of wellness course for UK medical students. So A Path with Heart. Back in the 70s, Carlos Castaneda wrote a series of books, ostensibly after a series of conversations and journeys and experiences with a shaman, a Yaqui Indian shaman named Don Juan. And the one thing from all of those books that I remembered was The Path with Heart, where Don Juan tells Carlos the most important thing in life is not what path you take in terms of a career, et cetera, but whether the path that you're on, the path you've chosen to begin at this point, and the path that you've stayed on up until this point is a path with heart. If the path is a path with heart, it is good. If it is not a path with heart, it is of no use. And if you find yourself on a path that has been a path with heart, and it suddenly for you you become aware of the fact this path no longer is a path with heart, then it's time to consider changing to a different path, and one with heart. So I've considered family practice a path of heart, and I've considered cultivating compassion a path with heart. I'm not alone in being interested in compassion. I think many, if not most, certainly not all, I'd have to say, confess that not all, people in medicine, students in medicine, come with a boatload of compassion and empathy, but I think the majority do. The tragedy is that unfortunately the system of medical education doesn't necessarily always try to preserve that compassion. It turns out that, we'll talk about some of this in the grand rounds tomorrow, but there are interventions that can actually help to preserve empathy and compassion in learners and reduce anxiety, reduce psychological distress, increase empathy scores, and increase reports of spiritual experiences. And in primary care physicians, a recent article in JAMA, an intervention in community-based primary care physicians showed that participation improves their sense of well-being and attitudes regarding patient-centered care, and remedied, corrected, or prevented burnout by physicians who are largely helping-minded, service-minded, and who often can give more to others than to themselves. We'll talk about this Golden Rule mandate, which is generally thought of as being externally oriented. We'll talk about internally orienting it as well. So compassion is really relationship-centered, a definition including deep awareness for the suffering of others, often including a desire to relieve it. Synonyms being sympathy, empathy, kindness, kind-heartedness. I think that's my favorite, actually, kind-heartedness and benevolence. So compassion is about relationship, but it can also be a relationship to ourselves. Let's not forget that. Merton, who spent many years very close to Louisville, down in Gethsemane, said, compassion is the keen awareness of the interdependence of all things. Now that awareness can be intellectual. It's a great place to start. If we don't feel like we experience compassion, just the intellectual appreciation and the intellectual buy-in that compassion is the keen awareness of the interdependence of all things. It's a great place to start, and then to choose to learn about and practice experiential behaviors that can cultivate that compassion. The Golden Rule has been around since Confucius, probably before, and this is going to be a series of statements from different cultures, different religions, different traditions, all talking about essentially the same thing. It's really quite remarkable. Listen to this. African traditional religion. One going to take a pointed stick to pinch a baby bird should first try it on himself to feel how it hurts. Buddhism. A state that is not pleasing or delightful to me, how could I inflict that upon another? Christian, love your neighbor as yourself. Confucianism, don't do unto others what you would not have them do unto you. Hinduism, this is the sum of duty. Do not unto others what you would not have them do unto you. Islam, no one of you is a believer until he desires for his brother that which he desires for himself. Jainism, in happiness and suffering, in joy and grief, we should regard all creatures as we regard our own self. Judaism, what is hateful to you, do not do to your fellow man. Shinto, the heart of the person before you is a mirror. See there your own form. Sikhism, don't create enmity with anyone, as God is within everyone. Unitarian, we affirm and promote respect for the interdependent web of all existence, of which we are a part. So Karen Armstrong was a Catholic nun. She decided to leave that path with heart and embark on a different path with heart. Is now a theologian, a religious historian, the author of books entitled The Case for God, A History of God, Islam, written I think after the 9/11 attacks, and Buddha. Was a recipient of a $100,000 TED Prize, which, if you know about that, is given unexpectedly to people who deserve it, with the hope that they will go out and realize their dream for a better world, being people that the board thinks can actually do something like that. So she took the $100,000 and convened a council of beings from various religions and set up the Charter for Compassion. And she also wrote a book called The 12 Steps to a Compassionate Life. The Charter for Compassion transcends religious, ideological, and national differences and activates the golden rule around the world. Her main work really is interreligious dialogue, harmony, understanding, and tolerance. But the book, 12 Steps to a Compassionate Life, doesn't just restrict itself to those communities. It addresses business, medicine, economy, various sorts of sectors within society, and argues for compassion and the golden rule as a value, as an ethic, underlying all of those. The Charter for Compassion, in part, says, the principle of compassion lies at the heart of all religious, ethical, and spiritual traditions, calling us always to treat all others as we would wish to be treated ourselves. Compassion compels us to work tirelessly to alleviate the suffering of our fellow creatures, even those we regard as enemies. The Dalai Lama is, by virtue of being the reincarnation of the 14th reincarnation of the Dalai Lama, he's supposed to be the embodiment, the reincarnation of the Bodhisattva of compassion, Avalokiteshvara. Embodiment, the reincarnation of the Bodhisattva of compassion. He's also the head of the Tibetan Buddhist religion. But if you ask him what his religion is, he says his religion is kindness and compassion. That's the universal religion. Buddhism, you may know, has become a magnet for a lot of people who are either were unchurched growing up, or who have decided to become unchurched, or who are still churched, or who through Buddhism go back to church, which is actually my experience. But he advocates for you staying in your tradition, taking from Buddhism what helps, taking from Buddhism what works, and there's a lot that's been well researched about what helps and what works from Buddhism in mindfulness-based stress reduction, other mindfulness approaches, compassion and meditation. He's an inspiration, he's a phenomenon, and it's too bad that he can't live forever. But love and compassion is the universal religion. That's my religion, he says. And it turns out that one of the ways to cultivate compassion, or that a way to measure, we think increasingly, a way to measure the success or the potential for cultivating compassion using some of these ancient techniques actually has come to us paradoxically and thankfully from modern scientific functional MRIs, showing that mental expertise to cultivate positive emotion alters the activation of circuitries previously linked to empathy in response to emotional stimuli. This is the beginning of a controversial field, neurotheology, the study of spirituality in a formal biomedical sense, is hopefully going to help us legitimize and promote the integration of spiritual practices, mind-body practices into biomedicine. Schweitzer's reverence for life is probably the term most people think of when they think of Schweitzer, and it really is about compassion from his point of view. Until he extends his circle of compassion to include all living things, man will not himself find peace. So Schweitzer was very keen on this quality of the therapeutic quality of the physician, the doctor as drug that Michael Ballant talked about. We'll mention that in a moment. But he describes it as the doctor inside the patient. Each patient comes to us with a doctor inside. They don't know it. And we are at our best when we help the doctor inside the patient go to work. Schweitzer knew nothing about psychoneuroimmunology, but he's talking about psychoneuroimmunology when he talks about trying to help the patient from another culture, from another language, from another race, learn to activate what's inside of them for their own healing. He didn't have penicillin during most of his time in Africa. So doctor-patient relationships, the doctor-patient relationship, I think, is also something that's been around for a very long time. The classic article by Peabody in JAMA in 1927 talks about a compassionate connection with patient care. One of the essential qualities of the clinician is an interest in humanity. For the secret of the care of the patient is in caring for the patient. I mentioned Ballant, a British psychiatrist who set up group support for general practitioners. Those Ballant groups have been used in this country and other countries off and on in family practice trainings a lot, where the psychological examination of the patient, the psychological response to the examination of patients is the subject of conversation for a group of physicians convened by a moderator or a self-led group, where this inquiry into our experience of the therapeutic relationship is the main topic of conversation. This was the first mention of the group support model, but I'll mention it several times today. It's critical to several of the things that I'm involved in and that I think you also may know a lot about too. AA, Weight Watchers being two of the most popularly, wildly successful programs. AA does much more for alcohol abstinence, for preserving families, for getting people into really a spiritual path than any doctor visit or medication we've ever used for that problem. Weight Watchers I can't say quite the same thing for, but it's still based on this group support, which is critical for some people, whether it's alcohol, tobacco, substance abuse, weight. So relationship-centered care, the interpersonal relationships between doctors and patients, staff and patients, among the healthcare team, and group visits or shared medical appointments, an area that I'm hoping to begin to work in and consult in, where I think that it doesn't have to be just a group of patients with diabetes. I almost said diabetics. Do you see what's wrong with that term as a compassionate physician? I almost said diabetics. A group of patients who have diabetes, it doesn't have to be a diagnosis-specific group. It can be but it can be people with diabetes, people with a need to quit smoking, people with high cholesterol. It can be a diagnosis-specific group. But there's emerging a model for reimbursement that I hope will allow us to convene groups like this and address the biomedical issue, but also address a global issue of health and prevention and wellness and moving toward mind, body, spirit health. There's also an intrapersonal relationship that each of us experiences individually and privately. And it's important not to forget that when we talk about compassion. It's certainly important not to forget that when we talk about becoming the best physician, nurse, psychologist, social worker, administrator, administrative support person, maintenance person. Taking care of ourselves is the first step in taking care of our children, our family, our job, our patients, our clients, our co-workers. And I would say relationships are the point of contact for compassion and spiritually sensitive care in the workplace or in the home place. It's a relationship with ourselves. Charity in the original Greek was agape, or spiritual love, defined as unselfish, loyal, and benevolent concern for the good of another, as the fatherly concern of God for humankind. So it's this other kind of motion. But Thomas Brown, an English physician and theologian, reminiscent of Schweitzer, preceding Schweitzer, is the origin, we think, of charity begins at home. He said, but how shall we expect charity towards others when we are uncharitable to ourselves? Charity begins at home. So Seeds of Compassion, Thich Nhat Hanh is one of the most accessible Zen masters who ever lived. The author of 50 or 60 books, the founder of Plum Village in France. He's from Vietnam, but is no longer in Vietnam for political reasons. He was an activist against the Vietnam War during that era. In our consciousness, he says, there are many negative seeds and also many positive seeds. Think compassion in all of our consciousness. The practice is to avoid watering the negative seeds and to identify and water the positive seeds every day. And he gives advice on how to do that. Two Wolves Inside You talks again about all this stuff that's in us. An old Cherokee is teaching his grandson about life. A fight is going on inside me, he said to the boy. It is a terrible fight. And it is between two wolves. One is evil. He is anger, envy, sorrow, regret, greed, arrogance, self-pity, guilt, resentment, inferiority, lies, false pride, superiority, and ego. He continued, the other is good. He is joy, peace, love, hope, serenity, humility, kindness, benevolence, empathy, generosity, truth, compassion, and faith. The same fight is going on inside you and inside every other person too. The grandson thought about it for a minute and then asked his grandfather, which wolf will win? The old Cherokee simply replied, the one you feed. So practices from all religions are suggestions about how to daily water the positive seeds and not water the negative seeds. Any religion, any faith tradition has recommendations that some people, unfortunately, because of the way religions are transmitted and the way religions are advertised, some people take as commands and as rules. If we could instead look at religions as partners with biomedicine, with modern psychology, in trying to help human beings become healthier physically, healthier emotionally, psychologically, and spiritually. These practices could be viewed not as rules or if you don't do this, you're not a good blank, but rather as suggestions toward spiritual health. Einstein's famous quotation in a letter to a rabbi, a distressed rabbi, talking about the circle of compassion. A human being is a part of the whole, called by us universe, a part limited in space and time. He experiences himself, his thoughts and feelings as something separated from the rest, a kind of optical delusion of his consciousness. This delusion is a kind of prison for us, restricting us to our own personal desires and to affection for a few persons nearest to us. Our task must be to free ourselves from this prison by widening our circle of compassion to embrace all living creatures and the whole of nature in its beauty. That's why I don't stop at mind and body. I don't stop at mind and body and spirit. I talk about mind, body, spirit, and earth as my understanding of what medicine is, so it's my understanding of what psychology is, so it's my understanding of health is. Nobody is able to achieve this completely, but the striving for such achievement is in itself a part of the liberation and the foundation for inner security. So I talked about practices. I have something here I'm going to offer you. I know you've just eaten. You're not forced to have chocolate. You're not forced to have grape. The grapes have been washed. The chocolate was broken apart this morning. It's all organic, earth-friendly, so that the earth has less poison in her. Just take one, take your choice and pass it around. We need to eat, and the question is there a way to eat in a way that can do more than just simply provide nutrients and calories to the physical body? Turns out that mindful practices in general, which make us more aware of the physical body, of the senses of the physical body, of our thoughts. Hold it. I forgot a very important part of the instruction. That was to take it and hold it. So that'll need to go. Luckily there's plenty. Please take one and hold it, so you can get a choice. So whether it's lying down flat on the back and experiencing the physical body, or sitting there in your chair with eyes opened or closed, feeling your feet on the floor. Just try this. Eyes open or closed. Open or closed. Feeling the feet on the floor. Feeling the feet on the earth. Feeling the socks or the stockings and the shoes on the feet on the earth. Feeling the seat in the chair. Feeling the back against the chair. Feeling the jaw and letting any tension in the jaw go. Feeling the shoulders and letting any tension in the shoulders go. So anything that brings our awareness to the moment. My hope is that at least for some of you during that brief experience, you are not thinking about the shopping list for tomorrow or this weekend or the NCAA or home issues or work issues. Hopefully at least for a moment, and that's all it takes to start, is just becoming fluent in moment-to-moment awareness of things that we sometimes take for granted. Eating is a great tool for awareness since we do it all the time. We know it's important. Yes, if you just send that back up front, people who may have ingested their meditation object already. I've done this before. I should have learned. Anybody else need a refresher? Did you all get this to start with? Okay, so the instruction is going to be very simple, very brief, very simple. There are a couple of ways to use eating meditation. What we're going to do is use it mainly as an intellectual appreciation of the circle of compassion. So I'd like you to look at this piece of food. I'd like you just to appreciate what you really already know. Think about the Big Bang. We just got through talking about Albert Einstein, time and space, and the circle of compassion. Think about the Big Bang. Looking at that piece of food. Think about the solar systems all across a universe that we think probably is endless. Think about our sun. Think about our rain. Think about our topsoil covering the surface of Mother Earth. Think about the need for all of those things to grow what's in your hand. Think about the farmers. Think about the truckers. Think about the grocers. And then tasting this, chewing this, and swallowing this with eyes open or closed. Closed is recommended for the full experience. Mindfully, taking a minute or less. You're on your own. So in the Healer's Art course, Rachel Remen talks about tools for remembering. any type of experience that helps us to remember who we are and what's important, and not be so attached to things that sometimes occupy much more of our mental time than we like. This type of meditation is one of those. So the Healer's Art, University of Kentucky, is now halfway through the spring iteration. We do this every spring. We're in our 10th year. 2 sessions the last 2 weeks. This week is spring break. 2 sessions coming up. The 4 sessions are Discovering and Nurturing Your Wholeness. This is for medical students, primarily first and second year medical students. We open it up to all 4 years. We have 24 students this year. Discovering and Nurturing Your Wholeness is session 1. Sharing Grief and Honoring Loss is session 2. Beyond Analysis, Allowing Awe and Mystery in Medicine. And Care of the Soul, Service is a Way of Life. Down below that I put the overflow theory of service. Rachel talks about filling ourselves up, taking care of ourselves, not in a selfish way, not in an egotistical, self-centered way, but filling ourselves up by good choices, preventive medicine, self-care choices, and then from that place of health and strength, sharing ourselves with others and serving others in a healthy way. The overflow theory of service. So the course, Healer's Art, began at UCSF from 92 to 98. She allowed it to be replicated at a couple of other schools in 2000 and 2001, then 4 schools in 2001, 2002, and then the real national extrapolation began 2002, 2003. We joined the family of courses here. We're in this list. You can see it's now grown to over 70 medical schools in the U.S. and some foreign schools as well. Rachel talks about deep listening as being one of the main things we focus on and we learn in the Healer's Art. When you listen generously to people, they can hear the truth in themselves, often for the first time. And when you listen deeply, you can know yourself in everyone. Do you hear some of the golden rule statements from the religions in this? So the goals of the Healer's Art are to help faculty and students experience relationships that are harmless. The primum non nocere is a Hippocratic ideal, first do no harm. Yet some medical students describe what can only be described as abusive interactions between themselves and people who are above them in the training hierarchy. It's much more prevalent, of course, among women medical students, but it also occurs among some men. The Healer's Art is an opportunity for students to be with students in a special way, for faculty to be with faculty in a special way, and for students to be with faculty in a special way. Described as non-judgmental, non-competitive, and harmless. Promoting healing in medicine, nurturing the human dimension in medicine, and embodying the core values of the Hippocratic Oath as a way of life, not just as a person going to work 8 to 5 as a doctor, but as a way of life. Compassion, service, altruism, love, calling, mission, covenant, and justice being examples of some of those values. And it's consistent with Flexner's vision. We think of Flexner as being the point at which we became scientific. We adopted the German model of scientific inquiry into medicine. But he's more than that, as you probably well know, here in Louisville. On the 100th anniversary of the Flexner Report, I think this is from Academic Medicine. Unfortunately, I don't have the journal. I think this is Academic Medicine. Medicine is challenged to realize Flexner's full vision for medical education, to ensure physicians are prepared to lead lives of compassion and service, as well as to perform with technical proficiency. He was talking about holistic medicine. Lo and behold, we didn't know 100 years ago. So the outcomes from the Healer's Art suggest that students feel like this is a very different type of small group. It's one where they feel like they benefit personally and professionally. It's described as an authentic community where you show up as yourself. I don't show up as the full cup faculty trying to fill up some empty cup student. We come with life experiences. Both of us come with life experiences. The seed talks get the conversation going. We begin to see each other what I call three-dimensionally. Students who've been riding the bus together to school for the last 6 or 8 months look at each other across a small group and said, I had no idea. They begin to see each other and hear things about themselves and about each other that they're quite surprised by and that they are quite touched by. Keeping a 3-question journal, we talked about religious traditions having recommendations for practices. It doesn't require a religious community to have a regular practice. In this case, it suggested that the faculty and the students adopt a practice during the course of the elective called keeping a 3-question journal. 3 questions being, you can make up your own questions by the way, the 3 questions suggested being, what surprised me today? What moved me or touched my heart today? And what inspired me today? When I think back over my day, it's usually got something to do with a child or an elder. But it can be other things. An animal, too. This is the end of a training. Once a year, there's training. These are faculty members, medical school faculty members from across the country. You have to go to Bolinas. Generally, you have to go to Bolinas on the West Coast, Pacific Coast, to legitimize your application for teaching healer's art. This is our group a couple of years ago meeting at my studio in Lexington. The logo, the calligraphy on the wall behind is posted there by the Lexington Zen community and is a representation of heart. Benson, I mentioned before in terms of the early research on meditation, he really needs to be credited with a lot of the tidal wave change that's happened over the past 30 years in our appreciation for the impact of contemplative practices to complement biomedicine. He was a Harvard cardiologist and snuck in transcendental meditators through the back door to do research back in the early 70s. He was concerned he'd be kicked out of his job if this was known about until the results were in and they could get them published. Turns out the relaxation response, in fact, did help a lot of cardiovascular symptoms, and his simple direction goes beyond any type of religious connotation whatsoever. It's not called prayer. It's not called meditation. There's no particular kind of robe or other garb you have to wear. He just simply says the repetition of a word, sound, thought, prayer, muscle activity, chewing, gently returning to this activity when other thoughts intrude. So if we carried that mindful eating on for 5 or 10 minutes, which we could do, we would simply follow these instructions. That would have been an example of eliciting the relaxation response. Some people make the mistake of thinking there's the stress response and there's the relaxation response, as if it were the stress response that we know about physiologically and scientifically, and the relaxation response we know about in the same way. That's almost true. It's better to say that Benson's coined personal phrase, the relaxation response, is a representation of the parasympathetic arm of the autonomic nervous system. So you have sympathetic fight or flight, and you have parasympathetic rest and rejuvenation. Benson also, after a long time in the Harvard Mind-Body Medical Institute, in his book Timeless Healing, said that if you start to take seriously mind-body medicine, and if you start to take seriously mind-body medicine as a practitioner, as a physician, as a nurse, as a clinician, or as a patient, inevitably you're going to be dealing with issues of faith, hope, spirituality. As a result of that, he chaired for a number of years a Harvard course, continuing medical education course called Spirituality and Healing. Dean Ornish is perhaps the best example of a dedicated researcher, randomized controlled trials using exercise, smoking cessation, nutrition, but also stress management and group support to reverse established coronary artery blockages. PET scan documented, people who have even in some cases been recommended for coronary artery bypass graft. Those people in some cases can sufficiently reverse those blockages that their symptomatology is reduced to the point that they're more functional, that their medication load can be reduced with the consultation of their cardiologist, and surgery can be avoided. Surgery which costs $30,000 or $40,000 and often has to be repeated in 8 to 10 years. His teacher, his spiritual teacher, down in the lower right-hand corner is Satchidananda, Integral Yoga founder, and his motto was love all, serve all, his particular take on compassion. Ornish believes actually it's the group support, not the diet, which everyone thinks of when they think of Ornish. Ornish actually thinks it's the group support that's the most important part of his program. He says when you help others, you also heal yourself. He believes the support of that group is pivotal to the success of the program, and perhaps the most important part of it. The UK Salvation Army Clinic is student-run. It was begun 20 or 25 years ago. It's one of the oldest in the country. I've been working there for a couple of years and the director of the elective. My particular interest, all those students learn how, this is first and second year students, preclinical. They're learning how to examine patients. They're learning how to take blood pressure. They're learning some differential diagnoses, some symptoms and signs of illness in consultation with the attending physician who's there. But my particular interest, aside from that, in adding to the elective, is this part of the course description. Students will be helped to develop the life skills of servant professionalism by formally cultivating self-awareness, interpersonal awareness, and compassion for themselves, their colleagues, and their patients. One of the ways that we do that in our session that I convene with them during the elective is we just practice loving kindness meditation. This can be done very quickly. We'll do it again very simply, very quickly. Loving kindness meditation can begin with ourselves, can then be extended to someone with whom we feel comfort, someone from whom we've felt love and compassion, can be extended to others with whom we work, can be extended to our enemies. Loving kindness meditation can be extended to that widest possible circle of compassion that we've been talking about. But it begins with ourselves. So I invite you with either eyes open, you be the judge, either your eyes open, partially open, or fully closed, just relaxing for one moment and thinking to yourself, may I be safe. May I be safe. May I be happy. May I be happy. May I be well. May I be well. May I be at peace. May I be at peace. And just notice any emotional quality to that experience, and then opening your eyes when you're ready. The Center for Mind-Body Medicine is a remarkable organization I was lucky to hear about 15 years ago. Began doing professional training with them and have been a senior faculty member with them now for 10 years. We use a mind-body skills model, a group model, again coming back to this group model. We have annual professional trainings. The basic training is in the fall, the advanced training is in the spring, and an enlarging global trauma relief program that began in Kosovo and is in Israel, Gaza, post-Katrina New Orleans, post-BP oil spill, southeast Louisiana, and Haiti, and with the U.S. military. The work in Kosovo produced the first randomized controlled trial of any intervention with war-traumatized children and the first trial of a successful comprehensive mind-body approach with any traumatized population, demonstrating a reduction in post-traumatic stress symptoms in highly traumatized children. These two psychiatrists, Afrim and Yusuf, in the war in Kosovo, Serbia, I didn't understand it when it was going on, certainly don't understand it now, but it was a horrible ethnic cleansing type of thing. Their society was crumbling. They described themselves as being just as biomedically oriented psychiatrists as anybody, but they came to this training because they knew their people needed help. And what we train the professionals. We train physicians, nurses, social workers, psychologists, school counselors, clergy, others that work with the population of patients and clients. So they came out of professional obligation, and as many people report, as a result of this training, their eyes were open, their hearts were open, their sense of possibility within medicine was expanded beyond a biomedical mind-body model. They're now part of the international program working in Gaza, Haiti, contributing their expertise from having personally lived through the trauma in Kosovo. We were invited to Israel, I think in 2003, or 2005. We trained Jewish and Arab Israeli professionals. There's now a training center for mind-body skills in Israel, and there's been an advanced training for people working with children which combine Jewish, Arab Israeli, and Palestinian professionals. This is an Israeli, clearly you can tell by her headwear, a conservative Israeli professional doing one of the mind-body skills, a drawing. We won't go into what we do in the drawings, but it's one of the first things that we do in the first session in a series of sessions. In Gaza, these are reports by people who took our training. Again, that professional target audience that we train. It has a very great effect. This is after the training, their feedback after the training. What has this training meant to you? It has a very great effect on my relationship with the family, colleagues at work, and mosque. It made me a new person full of life and hope. The techniques I learned in this training course, especially the meditation and relaxation, helped me a lot in controlling my own feelings and reactions. This work is as much about infusing compassion into medicine as anything else I've talked about. It's not mentioned on the PR, cultivate compassion, but it's what happens, I think, inevitably in a group support model where mind-body techniques are used, where hope and belief is nurtured and supported, that you see it on some of these statements, mind-body improvement, even mind-body spirit improvement, and certainly interpersonal as well as intrapersonal impacts. This was my group in Gaza. You can see the traditional women in the back, and I had 4 men, 4 women, and 1 interpreter. New Orleans, post-Katrina, post-oil spill, there's now a mind-body center in Louisiana. Our work is a part of the psychiatry department's outpatient at both Tulane and LSU. Unpublished data from New Orleans shows a decrease in compassion, fatigue, and anxiety and depression scores, decrease in overall PTSD scores, increase in vigor, just a sense of enthusiasm for life, and increase in purpose and meaning. And interestingly, an increase in a sense of interconnectedness, circle of compassion, the feeling of relatedness or attachment to others, and a sense of relationship to all of life. We've been given a $400,000 grant from the U.S. military to study vets back from Iraq and Afghanistan. We've been in Haiti now since the beginning. We have a Haiti program that is committed to long-term support, training professionals in this devastated country. So the online course that I helped to write and teach at Saybrook, my particular take on this, I have a co-teacher, my particular take on this is the therapeutic relationship. So that a couple of questions that I ask people after their readings include, how might the spiritually sensitive clinician support healing, including realistic hopes for cure, in individuals from various faith traditions or none who have life-threatening conditions? This allows a student to begin to think very seriously about some very important matters, reading some articles, thinking about their own work in medicine, nursing, social work, psychiatry, psychology, the chaplaincy, thinking about their family members who've been through some of this, and sharing a dialogue with colleagues and writing a paper, which I have to grade. Benson believes we are wired for God. I mentioned that earlier. Actually, I didn't use those words, but it was on the slide. Benson's takeaway from his work with mind-body medicine and its implications for spirituality are that we are wired for God. So Benson believes we are wired for God. How has this spiritual potential of mind-body medicine been demonstrated in clients and patients with whom you've worked? So the students are asked to think about patients they've dealt with where this is part of their memory of the dynamics of the process with that patient. Harold Koenig is an MD at Duke who is the leading researcher on spirituality and medicine. This talks about Koenig's proposal of a prevention model for religion's effects on physical health. So my question to the students is, how does your work now, or how might it in the future, reflect this mind-body-spirit model of medicine? I recently returned from Ecuador. One of the physicians that was on that trip shared that he had been searching for a greater purpose in life. Going on a mission trip and serving in a compassionate role as a physician, giving of his time and expertise, was an important part of his own self-care. The founding physician of the clinic that we manned down there, that we staffed down there, sorry ladies, the clinic that we staffed down there, his take on how we mostly are helping is by touching and loving people. Our repertoire of skills is getting broader as we learn how to take down medications, instruments. We don't have a standing clinic. We take everything with us to this very poor, isolated agricultural community. Their belief in the American doctor, the shamanistic quality we have by being the American doctor coming in, has great therapeutic impact. Think of the doctor as drug concept from Michael Ballant. And even the patients that are in a different world from us still experience stress, physical stress, mental stress, emotional stress, and physical stress. This lady with her 2 children said that she could not sleep. Her kids were having sleeping problems. Her relationship with her husband was poor. She'd been given some medication to help her sleeping with her nerves from her doctor. Number one, it's very expensive there. Medical care is free, but drugs are very expensive. And the medication caused side effects. She likes to run, so I gave her a prescription. I suggested that she either run or shake. It's a very, very friendly, kind of fun exercise. It's actually a way to meditate. It's a mindful movement. Just shaking any way you want to shake for as long as you want to shake, relaxing the jaw, relaxing the shoulders, relaxing anything else that's tight, is much more effective than you might think. And I recommended she do that or run or both. And if she chose to shake, do it for 5 minutes. That she then sit quietly and just watch her breath, like we've done some of today, for 5 minutes, and then that she write about any feelings she may have about her husband, about her children, about herself, about anything that's going on from a feeling and emotional point of view. And then if she wants to keep that, that's fine. If she wants to burn it, tear it up, that's fine too. The important thing is writing it down on a piece of paper has been shown, journaling has been shown to reduce a lot of symptoms that people go to doctors for, that people go to counselors for. They're not a replacement, they're a complement in an integrative medicine. So I gave her this 15-minute prescription twice a day. She can get child care for that amount of time. Exercise, quiet, writing. The older child had molluscum contagiosum. It's a wart-like viral condition, and using the power of the American doctor and the power of hypnotic suggestion, and this actually can work in this country too. I painted it with just some hand sanitizer, not antibacterial of any power. I let it dry, covered it with a Band-Aid, made sure she knew to keep it on there for 48 hours, gave her mother, or actually I think her mother had some sanitizer, so she knew what to do. I gave her some Band-Aids and gave her instructions to continue this until she was improved. The smaller child was not sleeping and was audibly grinding his teeth at night. As you know, children act out the family tension. It often shows up in the child. This child was grinding his teeth at night. I suggested that the mother actually bring both children, especially into the shaking, and that she not avoid shaking if she doesn't like it herself. Be sure she does it with the children and for the children, not as a substitute for her doing it for herself, alone with her own personal awareness of how it feels for herself, but do it with and for her children for 5 minutes a day. That child's not going to journal in that brief encounter. I can't get that across to him. But that's an example of an application of an expanded view of medicine, even in a foreign country, in a way that I feel very good about. I've got a phone number of the doctor's wife who knows how to contact her, and I'm going to get follow-up and see how they're doing. Since we were supposed to start Q&A a few minutes ago, I'm going to stop right there. And let's do Q&A now. So the title was Cultivating Compassion. And you can ignore the subtitle if you want to, for physicians and their patients. But aren't we all patients? Or at least potential patients? I've been a patient, big time.
Thank you so much for your talk. I really enjoyed all the rich examples you provided of cultivating compassion. I had a question. I'm actually a palliative care physician, and I teach medical students. And I think that the medical students, to me, are sometimes the best group to teach out of all my learners, because they seem the most open and the most in touch with humanity. And you know, they don't quite have that doctor identity solidified yet. And my question is to you, what do you do about those that are further upstream after we sort of beaten empathy out of it? How do you, is there a way or...
Did you say beaten the empathy out of them?
Yeah.
Okay, I didn't know y'all did that at U of L.
Well, I don't know. I'm being personal.
Yes, I know.
But I do wonder, you know, I feel like they're a little bit harder to get through.
Are you talking about third and fourth year?
No, I'm talking about residents and fellows and fellow attendants too,
Yeah.
colleagues. I feel like there's a sort of sense that this is soft, and I hear this all the time. Oh, palliative care, for example, is soft. Mm-hmm. It's not really that serious or that important.
Thank goodness. Thank goodness palliative care is soft.
Yeah. And so they you know, so some people are kind of closed to appreciating that part of medicine.
Mm-hmm.
I think because there's such an emphasis on the hard science of medicine. So what sort of thoughts do you have about our ability to overcome that or reframe that as physicians get further along in their practice?
So you've seen a little bit of research. The more research we get about mind-body interventions, about what could be called mind-body-spirit interventions, the better it'll be to cite literature, which will be helpful. But you know what? If we have to wait for that, our species is going to be gone before many of the people you're talking about are going to agree that we've reached a critical mass of randomized controlled trials. So how then do we do it? Well, I started a Healer's Arts course 10 years ago at UK. So now there are former UK students who are wearing I hope they are, wearing this little pin they were given, which I should have put on before I started. And when they go to apply for residencies, fellowships, whatever, sometimes they have on their CV they're a Heater's Art graduate. Sometimes the faculty person that's reading that says, oh, really? So that connection, that heart-to-heart affiliation of that past common experience is helpful in building community across the country. 70 schools, the best schools in the country. And unfortunately, some people have to wait. You know, some smokers don't quit till they have their MI. Some people don't recognize that that path they've been on has no heart until they've got cancer. Sometimes it takes a life trauma in themselves or a dear one for people to really be hit personally at a deep place. But I'll tell you, there are more people in deanships and chairships across this country that get this every day. So I'm hopeful. And my advice to anybody who feels that the weight of the world is on their shoulders to tackle this by themselves is forget it. Just, I would say, do what you do it well, find community, find support, ways to practice whatever your tools of self-remembering, your preferred tools of self-remembering are. There are many opportunities here in Louisville. And find colleagues. I'm in a sabbatical right now, but after 30 years in Irvine, a year and a half with a corporation in Lexington, I'm now in a sabbatical for the first time in my life. I've been working since I was 16. My next major project is to convene a community selected by invitation of physicians and nurses, psychologists, social workers, and chaplains who I want to be around, who I want to come to my studio and be with me and me with them. And that's going to do things that I can't even predict.
Maybe there's another question. Hard-hitting one, Ron?
Well, it's hard-hitting, all right. What you could speak to just a concern that I have is that the unintended consequence of HIPAA, which to me is so privatized, people silo them in this confidentiality that it makes it increasingly difficult to build those networks of support that you spoke so thematically about. We're just afraid to share information. People call, we can't tell them what's going on. I mean, I know there's all limitations to that, but I feel like we really lost something there in terms of what is very important and helpful in the patient experience.
I wish I knew more about specifically what you're talking about, because my experience in practice for many, many years is that I feel like I get around it. I don't know exactly what your field is and how your interaction with other professionals is impacted by HIPAA. Maybe it's, what is your field?
Chaplains.
So as a primary care physician, the lead physician in a patient's care team, you might say, it may be that I have an access that someone else in the team doesn't have, so I haven't experienced that. So I haven't experienced what your problem and your issue is. I would just say we have to honor HIPAA, and, legally, clearly we have to honor HIPAA, and I don't know, what in particular, give me an example.
A clergy person calls my office and wants to know how his parishioner is doing.
Oh.
I can't tell him.
Exactly. Well, I send people to counselors all the time. And I tell them, you can see this counselor, and that can be totally confidential.
So there's a patient in the hospital, and that patient's minister calls.
And you're a hospital chaplain.
And what can we as a church do to help? Well, I really can't disclose any information about it. Whereas a decade ago, we would have been able to make some assumptions.
So I think we have a similar situation here, actually. When I make that referral to a patient to go out for counseling, I tell them, you have a choice here. You can tell them whatever you want to tell them, and I know nothing about it. Totally up to you. Or you can tell them you want them to tell me about this, but not about this. And they can talk to me about the things you want them to talk to me about. Or you can tell them, tell Dr. Patterson everything. And then I get follow-up letters, or I get a phone call, or I can make a phone call, and we know up front, from the first referral point, that's where I would say if you're seeing someone in the hospital, perhaps there's a way for you to ask that person as a part of your general intake review right up front, how much confidentiality do you want and need around these conversations with your spouse, your children, your parent. I don't know how you do that, but that's the way I would approach it. We got to do it. Anybody else? Say, what were those experiences like? I'm just curious. You know, those were even smaller than the pink Baskin-Robbins taste spoons. You got such a very, very tiny dose of these things. You know, people go on retreats for months to do this all day and all night. You know this, don't you? So you got just a very small taste. But I'm curious, any comments about any of the experiences?
Well, I may have eaten my grape early, but I did it mindfully. It was wonderful. It was sweet. I just thoroughly enjoyed that one little grape. So thank you.
Oh, sure. You know, every time. Don't get me wrong. I'm not a Bible thumper, and I don't push any type of. I consider myself a member of all religions. But when I take communion, I think to myself, I've got to start thinking of this way every time I eat. Not necessarily body and blood. I'm not so crazy about body and blood, but the concept of nurturing the inner Christ, the concept of nurturing the Christ consciousness inside with every bite taken. Boy, do I get that. I just wish I could remember it more often.
What I love is just that I feel like these days that we're so into visual stimulus, and I feel like so much of what we take in comes in through our vision. And it was nice to actually pay attention to taste for a change, you know, because I really feel like we neglect a lot of our other senses. And I think it's getting maybe a little bit worse with our technology.
Well, the eating meditation can go on for a while. You can feel it. You can see it. You can appreciate the color, the reflection, the various tones. You can watch the kinesthetic movement, proprioceptive, of bringing it to your mouth. You can take forever. It's a very rich area for mindful awareness. Anything else?
I thought about our national problem of obesity. Our national problem of obesity, and
Sure.
we talk about repetitive behaviors as nurturing comfort, and I wonder if a lot of the comfort eating has much more to do with the mechanics, the repetition.
Habit?
Yeah. And that really is our national problem, more than that our stress, that we have lost so much of our humanity, if you will. And so in some effort to feed ourselves spiritually, we go through the mechanics. We don't really think about what we're eating. You know, the bag of Cheetos is gone. You know, we feel miserable, but we still maybe search for something else that we can gnash on.
The American Academy of Family Physicians, I was invited here by the Family Practice Department. The American Academy of Family Physicians has a program called Americans in Motion Healthy Interventions, Aim High. Fitness from three-legged stool of fitness. Healthy eating, not diet. Healthy eating. Physical activity, not exercise. Physical activity. And emotional well-being. And under all three of the categories, you fill out a little front and back survey. Questions about your frequency of eating healthy and being active and being relaxed. At the bottom of each one of those, it's I know I can improve in this area and I'm not ready to talk about it. Or I know I can improve in this area and I'd like to talk about it. Or I know I need help in this area and I'm ready to do something about it with your help. Once we move to a point where the conversation between this new team concept of healthcare delivery, where that somewhere is a part of every patient's primary care encounter and strategy and goal setting, it's unbelievable. I was a part of the research for that program nationally, and just having people fill that out, they can do it in 90 seconds, and talk to them about what it is they do or don't want to talk about. I can't tell you how many times I saw tears, even from the people who don't want to talk about it. And that's sufficient for me. I didn't get to the slide called crying. But for me, tapping into a sense of relationship, one-on-one or in a group, where people feel like they're cared about, where they feel like compassion is, they don't name it compassion, but they feel like there's something therapeutic going on, and that the provider cares about what's happening, and they're asking questions about deeply important things to these healthcare customers, patients. I think we can transform the public's experience of us. I think we can transform our own experience of each other, and I think we can transform our experience of ourselves. I see it. It's not easy, but I see it happening. I think I've experienced some of it myself. I think I see students doing it, and I'm hopeful.
May I ask a question at this juncture? You talked about buying a farm to watch the trees grow, and did I hear you say that the house has been turned into something like a retreat center where you lead sessions like this?
No, I didn't say that, though I've thought about doing that for 30 years. You know, sometimes you see a spot and you think, it'd be a great place to build a house. Wait a minute, it'd be a great place not to put a house. I've had a hard time figuring out just how much I want to improve this incredibly beautiful piece of property. So right now it's pretty much just just the dogs run wild. I get out there once a week, but yeah, hopefully eventually it'll happen.
Cathedral of the Hills.
Yeah.
Yes, enjoy it. I'm glad to be somebody who had the same impulse that I did. I've got a farm like that too. And what little cabin was on there has been carted off to build someplace else. Who knows who's enjoying that now? But at any rate, enjoy nature in that way. There is a critical side to this. We don't have time to explore it. But as you think about the impact and the necessity for evidentiary medicine, and compare that to what we're treated to here, I find myself with sympathy on both sides of that. And I know many of the people that John has mentioned in his presentation, and appreciate them with varying levels of appreciation. But that is the critical area. How are we wired for God if we are wired for God? What does that mean to say that we're wired for God? That's a question for the neuroscientists as well as for those who try to plumb the mysteries of our meditative abilities. So John has opened some really wide windows for us, and we'll get to hear him further in the morning at 7:30 at Grand Rounds. So set your clocks to be there at Lighthouse Auditorium in Rudd Building, and we'll hear more from John Patterson. Meanwhile, we'll express our appreciation to him for being here.
Thank you. Thank you very much.